think it's a challenging question because the resources are so limited in being able to provide quality end-of-life care and palliative care to undocumented immigrants in the U.S. in the hospital system outside of the safety net hospitals. So it is quite a challenge, but I think it's very important, and I think it's the first step is really bringing attention to it and then figuring out ways to provide that type of care, whether it be with charity hospice, whether it be within the hospital system itself, and being creative, thinking outside of the box. I have a lot of experience in just caring for patient clinical care within my own safety net hospital, and I think in the last few years I've been noticing it more frequently where a patient may come in with an advanced disease, one that could have been treated had they sought medical attention previously, but due to fear, maybe language barriers, or for whatever reason they didn't come to the hospital initially. Now they are in a situation where maybe treatment options are limited, and we're starting more to talk about palliative options or even hospice. So I think just through experience is how I've become passionate and yeah. I would say for the last about 2 years is when I first started noticing it, and probably within the last year is when I've been a little bit more involved in the research of it and kind of delving deeper into it. I think 2 to 3 key aha moments or things that people should pick up from the session. One is if your institution doesn't have a policy, go ahead and reach out to your stakeholders and figure out how can we build an institutional policy to protect our patients, whether that's an undocumented immigrant or not, as well as ourselves or the staff of the hospital within reason to make sure that patients feel safe to come seek medical attention. I think this can be done outside of the institutional policies. Also, another way could be doing things like posting up signs within the hospital or wearing pins that really allow patients to feel safe. Already what we do with palliative care is developing rapport, building trust with our patients through a longitudinal relationship. However, and sometimes, especially with critical illness, we need to develop that rapport quicker. And I think doing that with patients and also their surrogates, sometimes we'll have mixed families in which some patients will have some families will have undocumented immigrants and some documented. So that can cause a lot of anxiety and fear within them, and really trying to make them feel safe so that way they feel open in such an already vulnerable time. I think what excites me the most probably within it is I know that personally, individually, I can't quite make a change on my own. However, if we have more providers, more team members who are involved in caring for patients and advocating for our undocumented immigrant patients, we can perhaps increase the amount of resources that we can provide to this patient population such that they can also benefit from quality end-of-life care. Really, it's making sure you feel comfortable as a provider in obtaining this type of information from patients because many times they're afraid to disclose what their documentation status is. So unless we know about it, we won't know if this is an additional stressor on top of their already stressed situation in that they've been diagnosed with a serious illness. So I think one piece of advice I would have is in developing that trust and rapport is asking about documentation status, allowing patients to know that they aren't going to be at risk, that we're not going to be calling or reporting this, but that it's important to know from a psychosocial aspect. Yeah. So while I've been interested in it for the past year, I've actually been with the same hospital, the safety net hospital that I work at, Grady, for the last about 4 years. So I've been experiencing it for much longer. It's really been in the last year since actually the last meeting here when I met other members of teams that worked in safety net hospitals throughout the country that were experiencing the same issues that I was. So I think seeing it geographically, I'm in the Southeast, but in California, in Florida, and Texas, those are the states that have the most undocumented immigrants. I think just by way of population, they likely have more encounters than we do in Georgia. However, in collaborating with all of the other providers, it just became a topic that we all were very interested in.